If you've just been diagnosed with high cholesterol and your doctor handed you a pamphlet, pointed to a statin prescription, and sent you on your way, can I ask you something? Did that appointment leave you feeling like you actually understood what was happening inside your body? Or did it leave you with more questions than answers? Because here's the truth. Most seniors walk out of that office knowing what they have, but having no real idea how to fight it. And today, that changes. In the next 20 minutes, I'm going to give you 10 specific, science-backed strategies to manage your high cholesterol after 60. But before we get to the solutions, I need to show you something that most doctors skip entirely, something that will completely change how you think about this number on your lab report. Stick with me, because point number 7 is going to surprise you. And point number 10, I'm saving that for last, because it's the one that ties everything together. It's what I wish every senior I've ever spoken with had known on day 1. What exactly is high cholesterol, and why do you have it? Let's start with the basics, because understanding the mechanism is the first step to fixing it. Cholesterol is a waxy, fat-like substance produced naturally by your liver. In fact, your liver makes about 75 to 80% of all the cholesterol in your body. The rest comes from the food you eat. Now, here's something most people don't realize. Cholesterol is not inherently evil. Your body actually needs it. It builds cell membranes, produces vitamin D, manufactures hormones like estrogen and testosterone, and helps make bile acids that digest fat. So, why is high cholesterol dangerous? The problem is not cholesterol itself. The problem is when it accumulates in your bloodstream in excess, particularly a type called LDL, or low-density lipoprotein, and starts depositing along the walls of your arteries. Over time, this buildup, called atherosclerotic plaque, narrows and hardens those arteries in a process called atherosclerosis. According to a landmark study published in the Journal of the American College of Cardiology, elevated LDL cholesterol is a primary causal factor in cardiovascular disease, the #1 killer of adults over 60 worldwide. When arteries narrow, your heart has to work harder. Blood pressure rises. The risk of a heart attack, stroke, or peripheral artery disease climbs significantly. Total cholesterol above 200 milligrams per deciliter is considered borderline high. Above 240 milligrams per deciliter is classified as high. But the number your doctor watches most closely is your LDL, ideally below 100 milligrams per deciliter, and for those with heart disease or diabetes, below 70 milligrams per deciliter. Now, after 60, your risk profile shifts. Metabolism slows, muscle mass decreases, hormonal changes after menopause can spike LDL in women, and years of dietary habits compound. This is why managing it now, with precision, matters more than it ever did before.
You're going to walk away from this video with the knowledge of the 10 best ways to manage high cholesterol and bring it back to its normal level. Not as a list of things to avoid, but as a real, actionable framework your body will actually respond to. That's my promise. Let's build it together. Before we get into the strategies, let me tell you about Walter. Walter William is 62. He's a retired school principal from Ohio, active, not overweight by any dramatic measure, no family history he was ever warned about. At his routine physical, his LDL came back at 158. His doctor immediately recommended a statin. Walter said, "Give me 90 days first." His doctor agreed, reluctantly. Walter's failed solution? He cut out eggs. He ate more low-fat packaged foods. He walked 20 minutes 3 times a week. At his 90-day recheck, his LDL had barely budged. He was frustrated and about to give up. Here's what Walter was missing and what we're about to fix for you. His approach was based on outdated dietary myths and insufficient intensity of lifestyle modification. When we applied the 10 strategies you're about to learn, Walter's LDL dropped 34 points in 4 months without a statin. His triglycerides normalized. His doctor was genuinely surprised. Walter was not. He understood the mechanism. That's the difference between information and transformation. Let's get you there. The 10 strategies to manage high cholesterol after 60. Strategy 1. Upgrade your dietary fat, don't just eliminate it. For decades, we were told fat causes high cholesterol. The science has moved on. A 2020 meta-analysis in The Lancet confirmed that the type of fat matters far more than the total amount. Replacing saturated fats, primarily from red meat, butter, and full-fat dairy, with unsaturated fats from olive oil, avocados, walnuts, and fatty fish has been shown to reduce LDL by 10 to 15%. Extra virgin olive oil, in particular, contains oleocanthal and polyphenols that reduce LDL oxidation, the process that makes LDL truly dangerous. What you do? Swap your cooking oil to extra virgin olive oil. Add a quarter avocado to your daily meals. Aim for 2 tablespoons of ground flaxseed daily. These are not dramatic changes, but the cholesterol response is clinically significant. Strategy 2. Soluble fiber is your cholesterol sponge. This is one of the most evidence-supported strategies in cardiovascular research. Soluble fiber dissolves in water and forms a gel in your digestive tract that literally binds to bile acids, which are made from cholesterol, and carries them out of your body. Your liver then has to pull more cholesterol from your blood to make new bile acids, which lowers your circulating LDL. A review in the American Journal of Clinical Nutrition found that increasing soluble fiber intake by just 5 to 10 grams per day reduces LDL by an average of 5 to 11 points. Best sources: oats and oat bran, barley, psyllium husk, legumes like lentils and black beans, apples and pears. For Walter, adding a morning bowl of steel-cut oats with ground flaxseed alone moved his numbers meaningfully within 6 weeks.
Strategy 3. Exercise smarter. LDL down, HDL up. Exercise acts on cholesterol through 2 independent mechanisms. First, it activates an enzyme called lipoprotein lipase that breaks down LDL particles. Second, it raises HDL, your good cholesterol, which actively transports LDL away from artery walls back to the liver. A 2021 study in the Journal of Atherosclerosis and Thrombosis confirmed that 150 minutes of moderate-intensity aerobic exercise per week, brisk walking, cycling, swimming, combined with 2 resistance training sessions, reduces LDL by 5 to 8% and raises HDL by up to 9%. After 60, the resistance training piece becomes especially important because muscle tissue is metabolically active. It burns fat, improves insulin sensitivity, and helps clear triglycerides. Walter's missing piece was resistance exercise. 2 sessions per week of bodyweight or light resistance exercises changed his entire metabolic profile. Strategy 4. Plant sterols and stanols. Nature's LDL blockers. Plant sterols and stanols are naturally occurring compounds in plants that structurally resemble cholesterol. When you consume them, they compete with cholesterol for absorption in the intestine, and they win. Less cholesterol absorbed means lower LDL in your bloodstream. A 2021 study in the European Heart Journal and multiple clinical trials confirmed that consuming 2 grams of plant sterols daily reduces LDL by 8 to 10%. These are found in fortified foods or in concentrated supplement form. Many seniors are unaware this option exists at all. Strategy 5. Reduce refined carbohydrates and sugar. Here's the counterintuitive claim I promised you. Many seniors faithfully avoid dietary cholesterol, eggs, shrimp, but continue eating white bread, crackers, pastries, and sweetened beverages. This is backward. How many of you were told to avoid eggs? Drop a me in the comments. Excess refined carbohydrates and sugar trigger insulin spikes that stimulate your liver to produce more LDL cholesterol and increase triglycerides. A pivotal study in JAMA Internal Medicine found that adults who reduced added sugar intake experienced significant drops in LDL and triglycerides within 8 weeks. The target? Under 25 grams of added sugar per day for women, under 36 grams for men. Read labels. Low-fat snack foods are frequently the highest in sugar.
Strategy 6. Omega-3 fatty acids, targeting triglycerides directly. Omega-3 fatty acids, specifically EPA and DHA from fatty fish or high-quality fish oil, do not substantially lower LDL, but they do something equally critical. They dramatically reduce triglycerides, which are independently associated with cardiovascular risk. The Reduce It trial, published in the New England Journal of Medicine, one of the most significant cardiovascular trials of the decade, found that high-dose eicosanoic acid, EPA, reduced major cardiovascular events by 25% in high-risk patients. For seniors with elevated triglycerides alongside high cholesterol, omega-3s are not optional, they are essential. Target 2 to 4 grams of combined EPA and DHA daily. Fatty fish twice weekly, salmon, mackerel, sardines. Supplement with pharmaceutical-grade fish oil if necessary. Strategy 7. Manage stress, the cortisol-cholesterol connection. This surprises most people. Chronic psychological stress elevates cortisol, your primary stress hormone. Sustained cortisol elevation increases the liver's production of LDL cholesterol and decreases insulin sensitivity, creating a compounding loop. A 2022 review in Frontiers in Cardiovascular Medicine found that chronic stress is an independent risk factor for dyslipidemia, abnormal cholesterol, particularly in adults over 60. Practical stress reduction tools with evidence behind them. Mindfulness meditation, even 10 minutes daily, has been shown to reduce cortisol. Diaphragmatic breathing, consistent sleep of 7 to 8 hours, and maintaining meaningful social connection. These are not soft lifestyle suggestions. They are biological interventions with measurable effects on your lipid panel. Strategy 8. Quit smoking. Rescue your HDL. If you smoke, no dietary strategy will fully compensate for what smoking does to your cholesterol profile. Smoking chemically reduces HDL cholesterol and directly damages artery walls, making them more susceptible to LDL plaque deposits. Research published in Circulation confirms that within 3 weeks of quitting smoking, HDL cholesterol begins to rise. Within 1 year of cessation, cardiovascular risk from smoking is cut nearly in half. Cessation is one of the most powerful single interventions available for a senior with high cholesterol. Strategy 9. Moderate alcohol, manage weight. Excess alcohol raises triglycerides directly. Even moderate excess can produce what's clinically called alcoholic dyslipidemia. For seniors, the threshold for impact is lower than in younger adults due to changes in liver metabolism. Limiting alcohol to 1 drink per day for women and 2 for men, or eliminating it during active cholesterol management, can reduce triglycerides by 15 to 30% based on data from the American Heart Association. On weight, for every 10 pounds of excess weight lost, LDL typically drops 5 to 8 milligrams per deciliter, and HDL rises. The mechanism is reduced insulin resistance and less hepatic lipid production. You don't need to reach an ideal weight to see benefit. Even modest, sustained loss moves the numbers. Picture yourself 90 days from now, labs in hand, your doctor nodding. That can be your reality, not because of one change, but because of these strategies working together. Here's what I've seen happen too often. Seniors get diagnosed. They make some changes, maybe a few of the strategies we've discussed today. Their numbers improve a little. Then they stop, and 3 years later, they're back in that office with a cardiovascular event they didn't have to have. The reason isn't willpower.
The reason is they never understood the root cause framework. They were treating symptoms, not the system. I've been holding back one insight deliberately, the most important one, the one that when you understand it, makes all 9 of these strategies click into place as a coherent, self-reinforcing system, and I'm giving it to you right now. Strategy 10, the big save. Fix your metabolic health first. High cholesterol after 60 is rarely just a cholesterol problem. It is almost always a symptom of metabolic dysfunction, and until you address that upstream dysfunction, you are managing a downstream symptom forever. Now, most people stop at the diet, but strategy 10 is the reason why diet often fails. Don't skip that. Here's what the research says. A landmark paper published in Metabolic Syndrome and Related Disorders found that the majority of adults with elevated LDL and triglycerides over 60 also meet criteria for metabolic syndrome, a cluster of conditions including insulin resistance, central obesity, elevated blood pressure, and blood sugar dysregulation. Insulin resistance is the master villain. When your cells stop responding properly to insulin, your liver compensates by producing more LDL and VLDL, very low-density lipoprotein, triglycerides, and it suppresses HDL production simultaneously. You are fighting your cholesterol numbers while the machine that's creating them runs unchecked. This is why strategies 5, reducing refined carbs, 3, resistance training, 7, stress management, and 9, weight and alcohol, form the inner circle of this framework. They don't just address cholesterol, they fix insulin sensitivity at the cellular level, which turns down the liver's LDL production at the source. The practical protocol for strategy 10 is this. Track your fasting insulin, not just your blood glucose. Ask your doctor for a fasting insulin test alongside your lipid panel. If your fasting insulin is above 10 MIU per liter, insulin resistance is likely contributing to your cholesterol numbers, and your treatment plan must address it directly. When Walter finally addressed his insulin resistance with targeted carbohydrate reduction, resistance training, and 8 hours of sleep consistently, his LDL dropped 34 points. Not because he fought the cholesterol, because he shut down the factory producing excess LDL in the first place. Here is your 90-day cholesterol action protocol. Here is how to deploy all 10 strategies as a coherent system, not a scattered list. Weeks 1 to 2. Remove refined sugar and white flour products. Add oats and legumes daily. Switch to olive oil. Weeks 3 to 4. Add 150 minutes of brisk walking per week, plus 2 resistance sessions. Begin psyllium husk supplement, 5 grams daily in water. Month 2. Add omega-3 supplementation, 2 to 4 grams EPA/DHA daily with physician guidance. Implement 10-minute daily mindfulness practice. Set a consistent sleep schedule. Month 3. Request a full metabolic panel, including fasting insulin. Discuss results with your physician using the LDL particle size context from this video. Throughout, limit alcohol to guidelines, eliminate smoking, and weigh yourself weekly to track trend, not obsessively, but consistently. At your next lipid panel, typically 90 to 120 days, you will have data, real numbers showing a real response. That is the moment you walk back into your doctor's office as a participant in your own care, not a passenger in it. You came into this video with a diagnosis and a question. You're leaving with a framework. You now understand what high cholesterol is, why your body is producing it, and the 10 specific evidence-based levers you can pull to bring it back to normal and to keep it there. The science on this is clear. The strategies work. The only variable is you and your willingness to implement them, one at a time, consistently. 6 months from now, you could be the person your doctor calls a success story.
You could be the Walter William who proved that a diagnosis is not a destiny. That future is available to you. Start today. If this video gave you real clarity, if you feel like you finally understand your cholesterol, not just fear it, do one thing for me right now. Hit that like button and subscribe to this channel. Every week, I bring you this level of evidence-based, senior-specific health science, the kind your doctor simply doesn't have time to give you in a 10-minute appointment. And if you have a family member or friend who's just been diagnosed, share this video with them. It might be the most important thing they watch this year. I'll see you in the next one.